A new report details how some of the nation's elite universities discriminate against students with mental illnesses. The Ruderman White Paper on mental health in the Ivy League found several Ivy League schools are imposing involuntary leaves of absence on students who are experiencing mental health issues. The study grades the leave of absence policies of the 8 institutions, and none received higher than a D-. Dr. Miriam Heyman is in Boston. She's a senior program officer at the Ruderman Foundation and authored this study. Doctor, thanks so much for joining us. Can you explain the process of an involuntary leave of absence? What criteria are the schools using to decide if a student needs to be put on leave?
Sure. So first of all, I'm not sure there's a very important distinction between voluntary and involuntary leave, because many times students are forced or pressured into taking a voluntary leave. So the context is that colleges around the country are facing a mental health crisis. As many as 40% of undergraduates report feeling so depressed that it's difficult for them to function, and colleges lack the infrastructure to support these students. On the best equipped campuses, there's about 1 clinician for every 1,000 students. So in this environment around the country, colleges are providing or imposing leaves of absence for students with depression or any other mental illness. And a leave of absence is time away from campus, from the academic and social demands. And it is potentially a very useful opportunity for students to focus on well-being so that they can then return to campus healthy and able to take advantage of all that campus life has to offer. Unfortunately, many colleges are imposing leaves of absence on students with depression or other mental illness without first exploring other less drastic measures. And there are often also exclusionary policies alongside these leaves, such as forbidding students on leave to even come visit campus to share a coffee with friends.
Well, is there a reason an Ivy League school may be more inclined to ask a student to take a leave of absence over, say, a public college?
Well, let me point out that this problem is not by any means confined to the Ivy League. We focused on the Ivy League schools because they are the most elite in our nation, but this is a problem that I think touches virtually every campus across the country. And we hope that the Ivy League schools will make changes to their leave of absence policies and that other schools will follow suit. So, for example, many policies have a minimum length of time for a leave, saying you have to stay home for at least 1 full semester or 1 full year, when the trajectory of mental illness and recovery varies from student to student, and students should be supported to return to campus whenever they are healthy and able.
Well, let's talk about the grades. Let me ask you that you gave these schools, because no school got a grade above a D+. So tell us how you arrived at those grades.
Yes, absolutely. And again, this is not unique to the Ivy League. I think that schools around the country are struggling with this, but we hope that that the Ivy League will take the lead. So we looked at 15 different indicators of the written leave of absence policies, because the written policies reflect the institution's commitment or lack thereof to supporting students with mental health disabilities. So, for example, does the policy have a minimum length of time for a leave? Does the policy say that community disruption is grounds for an involuntary leave? While disability advocates fully acknowledge that a student who is a threat to the safety of others should not be on campus, community disruption is a very broad and vague term and can be applied in a discriminatory way. Another indicator that we looked at and gave grades according to was whether the policy states that students are entitled to receive accommodations which would maybe mitigate the need, such as a reduced course load or extension for assignments. These are accommodations that students with mental health disabilities are entitled to receive by law, and the policy should state that. Transparency is always a buffer against discrimination.
Well, go ahead.
So other indicators included whether students on leave were prohibited from visiting campus, whether the leave facilitated inclusion in university housing when the student returned from leave. And one really sort of piece of low-hanging fruit, does the policy identify a liaison for the student who is on leave, a liaison on campus? Yeah.
Interesting. So as you said, according to the American College Health Association, 40% of undergraduates have felt severely depressed in the last year, and more than 10% have seriously considered suicide. Are Ivy League colleges better prepared or equipped to deal with this issue?
So, again, that's national data. That's not just the Ivy League. I mean, I think that this is something that all colleges are struggling with. One clinician for every 1,000 students is clearly not enough. But the leave of absence is relevant because when there's buzz on campus, and we've heard stories about this, when students fear being put on a leave of absence if they disclose that they're struggling with depression or something else, they are less likely to seek treatment. So we want students to feel safe to access treatment as soon as they need it, not after depression becomes very severe and they're already considering suicide, but when they know that students who struggle with mental health disabilities are put on involuntary leave of absence without first exploring other alternatives, they're less likely to seek treatment.
So in addition to that, what are some of the effects of the leave of absence policies on the students when they ultimately return to the university?
Yeah, so I think a big piece is that quite often the leave of absence policies do not enable students to return. The criteria for reentry is often very ambiguous, or there are hurdles to jump through that are impossible for some students. For example, some policies say that a student has to demonstrate stability by taking classes at another institution while they're on leave before they can come back to the original school, and financial aid might not transfer from the original institution to a second one. So students might literally be unable to afford to meet the criteria for reentry.
Such a critically important issue. Dr. Miriam Heyman, thanks so much for joining us.
Thank you very much for having me.